WCLN 1170 Radio and Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Ladies and gentlemen, welcome back. Thank you for being with us today. We Should Know is on the air each and every Tuesday at 2:30. We come to you on Star Communications Channel 16, simulcast on WCLN Radio. There's a summation in the weekly newspaper each and every week. Today we're talking, as many people has, some folks may say we've heard enough about COVID-19, but we got two people with us today that not only probably has heard enough as well, but has to endure yet the continuation of that. And that's Director of Public Health here in Sampson County, Wanda Robinson, and Kelly Parrish. Kelly, I've got your position as Director of Nursing. Is that close enough, or is there another title I'm missing there?
Yes, sir, that's it.
That's it. So thank you, both of you, for being with us again. And I'll say that to some sense of yet again, because you were just with us back in late March, I think. And at that time, Wanda, we were looking at maybe one or not even a person on the list now. But when I look at the list as of July 7, we're looking at 1,134 cases. Is that confirmed cases of COVID-19 in Sampson County?
That's confirmed cases, and it was updated today to 1181, and that's confirmed cases for Sampson County.
So it's going up as opposed to going down?
Constantly going up each day, yes.
So let's talk about this as, again, not only where we were, but where we are now. We, in a short period of time, this is, I think, probably something that folks, when you sit down and look at it on the calendar, this is an extremely short period of time for us to go from that 0 to 1 area to now hitting beyond 1135, 40, and it just keeps going up. What's going on? And is there something that we're not doing that we can do beyond the 3 W's, the washing, the wearing, the distancing, those kinds of things? When we look at that, kind of give us a picture of what you see from the inside when you look at Sampson, surrounding counties, and the state. Sampson and Duplin being pretty hot spots. Tell us what we need to be thinking about.
So I'm trying to think as I talk about this. So back in March, when we first heard about COVID-19, it was new to us also. And then as a health department, our cases started to be submitted to us through the state in a very limited amount of testing. So as folks started to test more, and we had more people to come around with signs and symptoms, and then it continued to evolve. And after a period of time where we saw more cases that was contact, one-on-one with an individual, we then began probably mid-April, started to see more of community spread, in that we could not associate the cases with any particular case that we had been working with, but in that it was spread in the community, which caused us to pull back and say, oh my goodness, we do have a problem. So with that community spread, we began to get more and more and more cases, and that's how we've gotten to where we are today. We've been out there front and center since our first case, and over the last 3 months, have seen it explode here in Sampson County. So, and the one thing that has really caused us to pause is that this is new to us as a health department. We had never done this before. So having to work on those front lines with going out and investigating cases and coming back in and making contacts and those kinds of things has been a big learning curve. So that's kind of a broad picture looking at Sampson County, and in thinking now that we are one of those hot spots and that we do have high positive rates, and those are things that we are having to look at. And I don't know if Kelly, if you would like to add anything or not, since we've been there together from March to this point, looking at going from 1 case to 1,100 cases. So that is significant, I think, within itself, is the number of cases in that short period of time.
I know one of the things we talked about was early on was some of the areas, for example, nursing homes and places like that, that if it got into that, we could see anywhere from 300 to 400 cases explode, which happened in Wake County and some other counties. We saw a lot of issues there. Have we been relatively fortunate not to see any spread in those areas, or have we seen spread in those areas? Either one of you.
We've been very fortunate to not see that at this point. We may be heading there, and we anticipated that eventually, but we are one of the luckier counties that have not had that kind of spread with our congregate living facilities. But we have had hot spots in the county that have had a high positivity rate.
I noticed one of the things that we didn't talk about last time, simply I think because it was not really something that was being focused on, and that is this whole idea of tracking and tracing and how critically important it is. One of the things the governor has talked about, and Mandy Cohen, the Secretary of the Department of Health and Human Services, talked about, is this idea of being able to determine, as you talked about, the community spread, where it's coming from, where it initiated, how many people was in contact. And as the last I heard, the governor was looking at hiring maybe about 1,500 people statewide to do this particular thing. So apparently there must be something really important about it. How does that affect and impact Sampson and surrounding counties, and how important it is tracking and tracing? And maybe a better question would be, to start with, explain to us what that is.
So once we get a case, we contact them and do an initial interview. And during that interview, we ask them the pertinent questions, asking about where they work, who have they been around, who lives in their home. That helps us identify contacts to them being a case, and that we reach out to those contacts and get them tested at this point. And like Wanda was saying, we've gone from one place to a new place. We did have limited testing in the very beginning. Now that we've expanded testing so much more, we're able to see and get a bigger picture of what's going on. And in fact, we're looking at probably 50% of our cases being asymptomatic. Mm-hmm. And in the very beginning, we were only testing those with symptoms because that was, the testing we had available and the criteria we had available. But whenever we contact the contacts, we offer them testing, and then that's how we get a better picture of the spread. I think Catawba County just put out something today actually on their social media where they actually put a case out there, and they put that it was a gathering, and then they had a diagram showing you how it spread. Mm-hmm. It was like 16 people gathered in a home for, it must have been a birthday party or something. Mm-hmm. And it showed how it spread and how quickly it spread and how it affected other areas of the state. But that's kind of what we do.
One of the things that the other day, in fact, I think just very recently, in the past 48 hours, I picked up a comment from Dr. Deborah Burks, who is on the national committee that's looking at a lot of this stuff. She talked about how important it was to not have indoor meetings with not over 10 people, and how important it was not to have gatherings outdoors with over 25. Do you think we're doing that? Or, I noticed the commissioners are not meeting indoor. They're actually meeting via Zoom and those kinds of things. But are companies and other folk out there that typically are used to having meetings, are they still meeting inside? Do we know? Should we know? And what can y'all do about it?
So I think what we're trying to do, we are encouraging, wearing our mask, social distancing, and looking at folks being 6 feet apart, and then the sanitizing of and keeping your areas clean or whatever. So when you have those folks that are gathering in like a facility or whatever, say us here today, there's 3 of us here. I cough, you and Kelly may be a contact. You leave here today, go back to your family, and you may start having symptoms So there, we've spread from me to both of your families. Now, if you start having symptoms and you're tested, then how many folks is in your family? How many folks is in your family, Kelly? And where have all those folks been, and who have they been in contact with? That's contact tracing. That's why we're trying to say, cut down the number of folks that you're meeting with, using media to phone conferences. And most of us in the business world are trying to do that now. We are not having those large gatherings that we used to at one point. We're not doing that because we know when we all come together in a small place like this, we are a medium for COVID to spread amongst us as a group. And I want to back up a minute in that the governor has seen the importance of contact tracing. And so with bringing all these new people into our system, public health has traditionally been a bit underfunded. And you think that we've had maybe 1 or 2 communicable disease nurses in our facility, but when you've got 200 and 300 and 400 people that you've got to contact and follow, we were just not able to do that. So our message to the state was, we need help, and we need help now. So that's why they've tried to hire people and bring them out into the counties to work with us to help make those contacts with all these individuals that's testing positive and their contacts to stop that spread. Stay home, wear your mask, wash your hands. If we can keep them at home, out of the public, that's our way of controlling the spread of this disease. That's what we are trying, that is our goal right now.
This is something I want to kind of carry on after our break that we're fixing to take here is how do we press upon folks the importance of doing what you just said, and let's talk about that when we come back. How do we make that happen? Ladies and gentlemen, we're going to take a quick break. We're talking about COVID-19 with the Director of Public Health and the Director of Nursing here in Sampson County. We'll be back in a moment.
Experiencing slow internet? If you have a fast internet package, the problem is most likely your wireless router. With more devices using Wi-Fi, your wireless router may not be able to deliver the speed and coverage you need. We now have the leading solution to enhance your internet experience. Using small devices in a mesh network, these Wi-Fi appliances cover just about any size home so that all your devices can operate to their fullest potential. Whole home Wi-Fi from Star Communications. Get the most out of your internet connection.
Ladies and gentlemen, welcome back. Thanks for being with us. We're coming to you from Star Communications, Channel 16, WCLN Radio, simulcast each and every week at 2:30 on Tuesdays. Our guest today are folks that's been on previously, and we're glad to have them back. Kelly Parrish, Director of Nursing, and of course the Director of Public Health here in Sampson County, Wanda Robinson. Wanda, folks have known you for a long time, and your name is synonymous with public health. We're talking about a public health crisis. Underline the word pandemic twice. We're talking about a world global pandemic. And the discussion today is how is it impacting this area, particularly in this part of the state, particularly in Sampson and surrounding counties. Kelly, you mentioned a while ago in both Duplin and Sampson, we're kind of looked at as a kind of a hot spot. We've got over 1,100, 1,200 cases going on now. It keeps bumping up. One of the things that we talked about was the idea of masking and washing your hands and 6 feet apart. But there are people who just choose not to do that. What do you say to those? And I'll start with either one. What do you say to people that choose not to do that?
We just ask that they do wear the mask, do wash your hands, do wait the 6 feet. These are relatively simple things that you can do to really, and it's not even all about protecting yourself, it's about protecting your loved ones and those around you. What you could potentially pick up at a grocery store while you're getting groceries, if you're not wearing a mask, you could potentially pick it up and then take it home to your grandmother or your mom or dad or one of your loved ones, and it could have detrimental effects.
Wanda, I've noticed that, and having at least one funeral I was attended just recently, the funeral homes and the churches have taken into account a lot of this, and they're really using a lot of restrictive kinds of things. They're distancing people in churches. Normally, a lot of folks you see that are passing away, they're having private services at the graveside. They're very respectful of what public health is trying to accomplish in saving people's lives. How do you translate that to other groups and functions where people decide they want to meet, no matter what the venue is? They want to get together. Somebody mentioned a while back that this particular person said, well, I just was kind of got lonesome and decided we'd have a big party, and it's like 50 or 60 people in an enclosed location, which violates everything that you guys have been talking about. Talk to us about that.
So,
what's happening to the psychology that we don't understand there?
I think, and that's what frustrates us somewhat, in that we see on a daily basis the number of cases that are coming in. And when we have had some instances where people have chosen to have these inside parties and that kind of thing, and have had issues in this county with cases coming out of these individual parties. So, you know, we want folks to it's fine. Well, it's not fine, because you think if you have a party of 20, 30 people and you've got a case that come out of that party that may affect grandma, grandpa, aunt, or uncle, that may end up in the hospital on a respirator, which could be the end result, that is an issue for us. And that's why we're trying to warn people in that distance yourself. Don't have those inside gatherings where you have the potential to spread, because if you're coughing or talking, that's how this is being spread. And so we're discouraging that, and think, just because you may not you've got your family members you need to be concerned about. That's what I'm saying. Mama, grandmama. My mother is 81 years old. I am not allowing anybody to visit her, because I know with her health issues that should she contact this virus, it's going to be detrimental for her. So if you're not thinking about yourself in wearing masks and doing the distance, and think about your family members and others, because there could be dire consequences. And that's what we're trying to impress upon people. Don't have these parties. Don't have these mass gatherings. Wear your mask. Distance yourself. These are proven preventive measures that can help us decrease the incidence and the number of cases that we're receiving.
Kelly, one of the things that tends to not only add gravity to what Wanda's saying is that recently the World Health Organization talked about, and apparently there's some substance to this, but they talked about how these molecules that we thought were in the air for a short period of time are now lingering around for, their words not mine, up to 16 hours. Which is phenomenal, and that a molecule or particulate could be still in that room or still moving around. What does that add to this conversation?
I think it just adds it's just scary. It is honestly just scary that we do not know a lot about this virus yet. And we're trying to do the best we can right now with what we know. And if wearing a mask could potentially help limit that spread, flatten our curve, then that's what we need to do. But it's scary because we just don't know yet.
What do you say to people that says, okay, well, we're going to have our function, and you're aware that this is going to happen? Is there anything that, other than the governor's current order 147, I think, that still keeps us in phase 2, and he's talked about that. Is there anything that you can do to prevent that, any kind of action, or do you just basically step back and shake your head and say, oh my God, you know? I guess at some point in time, you know, we have laws if you drink and drive, and you typically, you know, somebody's going to get killed. You know, people can get arrested and put in jail. But when you know people are coming together, and eventually, as you pointed out, somebody may end up being dead. Is there anything that can be done intervention-wise?
I think We do have our executives.
That's a slippery slope, I know, when I ask that question.
It is. All we can do is encourage our businesses, our grocery stores, our convenience stores. I know now even, there is an order to wear your mask when you are out in public. And businesses should drive home that point in that you cannot come in unless you've got your mask. That should be the driving force, and we're hoping that they will help us with that. This is very frustrating in that we want to, you have an issue, and we have gone to some businesses to say, especially where we have had several cases, this is a problem. We need you to help us. Mm-hmm. And but you do have this rule, and it is an executive order by the governor, and all we can do is, encourage our businesses, post, remind folks. That's pretty much where we are right now.
Kelly, one of the things that Wanda mentioned is that we do have an executive order by the governor. We do have a declaration of the county commissioners here, a state of emergency for Sampson County. These are supposed to be kind of shock and awe moments. These are supposed to be documents that says, stop, listen. Apparently, just in our conversation in the past few minutes, it just seems like there's a sense of numbness. Yeah, we saw that, big deal. Let's, what are we going to do? How do we get beyond that point of the seriousness?
If we knew the answer to that,
if we had the answer to that, it'd be a great day. Yeah.
I really don't know the answer to that, to be honest with you. All we can do, like Miss Wanda said, was just encourage to wear the mask. We have tried different social media outlets and things like that. Of course, most of the time with the cases, when you look at the data, we have more cases in like the middle-aged folks, but then our deaths are more in the 65 and older. And that's kind of been where we've been really the whole time, when you're looking at 65 years and older being your most at-risk group. And we try to preach about, like what we were saying earlier, about wearing your mask, not just to only protect you, but to protect your loved ones too. I really don't know how else to try to get around or get that through to people.
Clearly, there's not a sense by anybody in leadership, whether it's political leadership position, what have you, to try to do anything any more than what we're doing as far as trying to do publicity. There's not a sense of any enforceable action at all with this. Is that rational to think that sometimes you don't have to go out and say, hey, y'all gonna have to break this up?
It's not, but and I think that's where we still have the issue in that people need to understand that this is a pandemic that can affect anybody, anywhere, at any time. And to say that I'm not affected by this and I'm not gonna it really frustrates us, and I'm trying not to get upset about it because we're out there pounding and trying to make these contacts, isolate folks, get them out of the general public, and yet we've got folks that say, well, I'm not going to have anything to do with it. Help us. We need help in that if these certain places are not abiding by the rules, help us, because that's the only way we're going to bring these cases down. Mm-hmm. We're sitting here, Sampson County does not have, our population is, when you look at us compared to some of the larger counties, it's not that much, but we are a hot spot. Mm-hmm. Sampson County is a hot spot because of the number of positives that we're having. We are real, and that is an issue for us. So if everybody don't help us, we're going to continue to see the deaths and that kind of thing. So
we're going to take a quick break, and we'll be right back. We'll be back in a moment, ladies and gentlemen. Call a friend, stay tuned. We're talking about COVID and the spread thereof.
You come out to replace a bad sensor, and that adds a 5-year commitment to my contract, and you don't tell me? Here's your sign.
Switch to the sign that's keeping homes secure and customers happy all over the area. Security from Star Communications. We pride ourselves on fair pricing and quick, friendly service every time.
Somebody trying to break into this place?
Security from Star Communications.
Ladies and gentlemen, welcome back. Thank you for being with us today. I want to remind you, if you have comments or questions or suggestions, please send that to us at weshouldknow.edu@gmail.com. That's weshouldknow.edu@gmail.com. If you want to drop us a card or a letter, you can send that to Post Office Box 1482, Clinton, North Carolina. We air every Tuesday at 2:30. It's simulcast on Star Communications Cable Channel 16 and WCLN Radio. We're talking about COVID-19 today to two folks that not only know something about it, they're living it, and sometimes can do things and sometimes they can't. Wanda Robinson, Director of Public Health, and of course Kelly Parrish, who is the Director of Nursing for that department. Ladies, thank you for coming in and sitting down talking to us again after going from 1 or 0 the last time we were talking up to well over 1,150 now, I think, cases in Sampson County. The last segment we were talking a lot about trying to convince folks to, and I don't want to use the word comply, but to be willing to help, as one as you pointed out so clearly, to help others. Are you willing to help others? So do these things that we ask you to do, and you can help that. You mentioned your mother, somebody like your mother, or people that have underlying health issues, or people, Kelly, that's beyond that age of 20 to 40 years of age that are in vulnerable years. I can remember those well. Let's kind of move into that channel of thought. What do you need to say, and how do you get the partnership you need and the examples you need to step up and demonstrate these things that need to be done? And I think that question is probably the one, if you guys can answer that, we might could market it and get it spread across the country.
I think the main thing is we want to make sure our leaders in the county are doing these things and helping us limit the spread and helping our case numbers. We do not want to be number 2 in the state for a positivity rate. That's just, it's terrible when you look at the population compared to our population compared to Mecklenburg County.
Yeah.
If the leaders are not following the guidelines, then why, I mean, you know, and I know that's what everybody feels is, well, they're such and such is not doing it, so I'm not going to do it either. So we really need leaders, everybody, to help us, help our county. And
I also expanded on what Kelly just said, the economic impact of having of the businesses when we have cases in those businesses. So when we think about if you've got 3 or 4 cases in your business and you're having to send folks home for that 14 or whatever days, and you may have to close your business because you don't have those employees to provide the service, look at that economic impact that you've just that's just occurred. So that's another reason for businesses and people in the community to say, I need to stay put so that we can all go back to work and become a bit more productive in our society. So it's just not a public health issue, it's an economic issue, especially here for Sampson County. So that's another piece of the pie that we're having to look at.
It transcends
so it does. So, you know, that's why we help us, because it's not going to only benefit the county, it's going to affect you as a business person. So I would hope that our leaders in the community, be it from daycare, schools, our medical centers helping us. I mean, all these which are out there saying, help us, help you, because we can save lives if we all pull together and wear a mask. The most simple thing, wearing a mask. I've heard people say, well, I can't breathe, or it just feels uncomfortable, whatever. But what if you're sick in the hospital on a ventilator? Then that is the ultimate that could happen. So,
Kelly, one of the things that we've noticed recently, and I think what Wanda's maybe alluding to, is that Starbucks just recently said, if you come in our facility, you're going to have a mask on. Just pretty blunt, just straightforward, no excuses. If you enter the facility, you will wear a mask. We have, as Wanda alluded to, a lot of, I think, businesses and chains that have said we request that. But I'm not aware of anyone that said, now if you enter, you're going to have a mask and have monitored that. Are you?
Not that I know of.
Because I guess businesses could do that.
They can do that on their.
They can do that. They can do that. They can say you will not
so if you
come in.
If you don't have it, you don't come in.
And even whenever I was in Wilmington last weekend, everywhere I went, they said, "Where's your mask?" And you had to make sure you had your mask on. And they were telling, people were going out of the store because they didn't have it. So that is something the businesses can do. And that's really, like Wanda said, protecting their business and keeping it open, because we're in these softer openings in order to keep on with the phases like we should be able to. We need to make sure that we're able to stay open, able to maintain. And really it's not the health department shutting these businesses down that you see in Sampson County. It's because, like Wanda said, it's the employees that are being taken out, and then they're not having the staff to cover to be open.
And it is to your point, Wanda, a balance, certainly a balance between the public health and the economics. But at some point in time, there is a crossover. If you don't do it and people end up sick, and we have a lot of folks, overwhelmed the hospitals and so forth, there's going to be a drop in economics anyway. So it's kind of a puzzling dynamic. The other thing I want to just while we're on this subject, and I want to segue to something else, but is this idea from the federal level that there's a need to look at these areas, like rural areas like we're in, as you just mentioned, Kelly, with Sampson being a hot spot and Duplin being a hot spot. It's the numbers per thousand. Based on those numbers, we're ratcheted up. So they're looking at it from the federal level, and the comment from Dr. Fauci and others is that they're going to be sending people in to these areas to look at it and see what's going on. So if they come in, if somebody comes in from the outside and says, here's your number, we've tracked this, this, and this, and this, and you look at them and say, well, here's what we just talked about, what some of our problems are, what can they actually do? I guess that's my question. Is there any fix if folks are not willing to step up?
So it's not, I think it's not that is there a fix. What is actually happening right now is, since we have been identified as a hot spot, because there's 9 counties throughout the state of North Carolina that have been identified as really hot spots. Sampson County was number 10. And because of our high positive rate.
If you got to look at good news, that's good news, I guess.
Okay.
We want number 1, right?
Right. So that's where we've started with the additional testing. And in that, certain pockets of Sampson County where we've had more cases identified more so, there will be pop-up testing sites that will go in, and with the goal of testing more of our high priority residents here in the county, looking at targeting the African American, looking at targeting the Latinx, and targeting the Native American population, trying to reach the population and get those that may be positive and pull them out and isolate, so we can hopefully decrease some of our issues with cases here in Sampson. So with them coming in and helping us identify, then we can track and pull out and hopefully decrease some of our rates. So hopefully with more testing and identification of cases, that will help us put a plan in place and hopefully decrease some of our case rate. So
does other counties, I know you guys talk to other health directors in surrounding Duplin and other counties here, are they approaching this similarly in the same way that you guys are?
We're all working towards one goal, and we talk because Sampson County is sitting here, and you've got Duplin County on one side, Bladen County on the other side, Cumberland, and
Johnson County,
Harnett, and so we not only our cases here, they come from people live here in Sampson but work outside the county, and so that's where we may have issues in identifying folks. But we are all trying to decrease those cases by the contacts, isolation, and that kind of thing.
Does all that data go into one state database that's shared nationally? How does that work? You get a case, Kelly, and you program it in. Is there like one central database that impacts both locally, nationally, and on the state level? And is that working?
Mm-hmm. So we have what's called North Carolina Electronic Disease Surveillance System. We call it NCEDS for short, but it is a database where all of the cases come through that database. So some of the labs are even electronically fed into that system. So if the lab or provider doesn't report it, or it gets missed, it's automatically fed into our system. That system is what gets reported also to the CDC. Because of this being such a unique thing, and like we were talking about earlier, we have that system for our cases, but there was nowhere to put the contacts to the cases. So with COVID, that's a very important piece, is getting those contacts tracked down so that we can try to eliminate that spread. So they made another system for just the contacts. So that's what they're using in North Carolina, and you'll hear the governor speaking about that with contact tracing. That's what those individuals being hired for, and our health department's using those same tools for the contacts.
We're going to come back from the break, and I want to talk more about the testing piece because there are a lot of questions in that area. Ladies and gentlemen, stay tuned. We're talking about COVID, where we are now in this unbelievable journey, and particularly as it relates to testing. Stay tuned, call a friend. We'll be back in a moment.
To get the most out of your electronic devices, you need a strong internet connection and a protected home Wi-Fi network. You need high-speed internet from Star. Star has the fastest, most affordable high-speed internet service available for all your devices. We have no long-term contracts or high-pressure sales. Our service speaks for itself, and switching is hassle-free. We take care of everything with free installation from a local company. High-speed internet from Star. Internet at the speed of life.
Ladies and gentlemen, welcome back. I want to thank you for being with us today. We're coming up on the last segment here of We Should Know. My name is J.W. Simmons. My guest today is with Public Health, Director of Public Health, Wanda Robinson, and the Director of Nursing for that entity is Kelly Parrish. Ladies, thank you for being with us. We're coming up on the last segment. We've got a lot of stuff I want to kind of touch on. One of those things is the testing piece. The conversation I hear quite often is that I got the test. They told me I could find out in about 3 days. It's been 4. It's been 5. Is the test not valid? Do I need to take another test? Do I need to go to Raleigh and get a test? Help folks understand what's going on with the testing. Wanda, you mentioned pop-up sites here and there. The testing is no charge to people, correct? Let's clear that up. There's no charge to it. If I'm tested, Kelly, and I'm throw out several questions here to kind of consider, but if I'm tested and I test negative and I go, as Wanda mentioned a while ago, and I meet a few friends at wherever to get a cup of coffee, I don't have my mask on and we're laughing and talking, and somebody had chews a couple of times, and in less than, I could be positive in the next 24 hours.
Right.
So people ask the question, well, what good is the test? Because it gives me only just that point in time. Let's talk about all those issues, and I'll start with either one of you.
So as far as the result time for the test, that is a hot topic, especially lately. We were to a place where we could get the test results within 48 to 72 hours at one point. Then the test expanded. So naturally you have a lab that's inundated with tests or specimens, and just getting those, depending on what they have in their queue for pending tests, will determine how long it's going to take them to get those tests out. We have no control over that at the health department or any provider that's doing the testing, that they're sending the specimen out. We send our specimens out. They either go to our state lab, which is in Raleigh, or they go to LabCorp. So we don't do any testing in-house as far as processing the specimen. So once it leaves our facility, it's out of our hands until they send us those results back. And depending on how many tests they have will determine when we could get those results back.
It seems that once those tests leave you guys, obviously it's in the hands of the state or federal government. And what we're finding now is folks is trying to determine, well, who do I point the finger at to say, why don't y'all do something and make this quicker, or where's the facility needs? And then we hear oftentimes some of the major news channels put out information, well, it's the federal government is not sending us what we need. We don't have enough. Then the federal government says, well, we sent that. And folks are totally confused and dazed. It's like a maze of, well, we want to find out, we want to get more tests so we can get a point of where we're at saturation-wise, but yet then they see the confusion in the system.
Mm-hmm. And we have no control over that. Just like Kelly just said, those tests are going to our reference lab or to the state lab. And when you've got a couple of thousand, because the governor wanted to expand testing, and we have expanded testing, when you've got a couple of thousand that's coming into a facility at one time and they're not prepared for that number, this is what happens, in that you are going to have a little bit of a backlog, in that your test results aren't going to come back as fast as they were when we were not in at this point a couple of months ago or a month or two ago. So folks have to be patient with us in that, we are pulling those test results twice a day. Positives are being called to us, and as soon as we get them, we are calling them out. But during that interim, while they're waiting for that test result, they should be isolating at home, if wearing their mask, doing those kinds of things until we can say yes or no, you are not positive. So, preventatively, yes, you have not received your test results back, but we're asking you to do those things while you are waiting for that test. And like I said, we have no control over that. But hopefully, as we increase testing, that the sites that are actually like our state lab and LabCorp can increase their personnel to help with getting those results back out to the counties, because this is just not Sampson County. This is the state of North Carolina. So that is the difference. So
you mentioned something I think is important, and just that comment, it struck a point here, is that the governor mentioned that there are populations that in the isolation piece that you mentioned, that somebody tests positive, they need to be isolated, but yet they don't have anywhere, quote, to be isolated. They go home, they don't have enough room at home. Maybe they have the house is 4 rooms and they got 6 people in it and 1 bathroom, and this is not, I mean, this is real world stuff. So they don't have anywhere to go. And even, let me segue that also, say, okay, like with a nursing or rest home, somebody gets COVID, where does that person go? Because, I mean, who wants to, do you have to send them to the hospital because they're symptomatic? What happens to that person? Does a rest home or nursing home have to close down? How do you deal with those equations? So
they have guidelines set for them as well, and even businesses, healthcare workers. So even though we're saying that they will isolate during their, whenever their lab is pending, it really depends on where they're working. If they're a healthcare worker, there are different guidelines. If it's a long-term care facility, they have their own guidelines. When they have a resident that tests positive for COVID, and if they did go to the hospital, and that's where they got the test done, the hospital is going to send that patient back if they need those beds for someone else. They can't keep that patient there just because of COVID. So they'll take that patient back. They have their own guidelines as far as isolating that resident to one area. They're in a private room. they'll have dedicated staff taking care of that patient. And so they have their own guidelines to limit that exposure.
And that's one of the things where that came up first, I think, was in New York, where there was a number of people that was sent knowingly. COVID was sent back into the nursing home, and that was a big blow-up point, as you recall, early on. So it sounds like what you're saying, we're supposed to have learned from that that the responsibility of that falls on the nursing home.
And when we say isolate, of course, you know, you do have to isolate at home, and unfortunately, some residents don't have the opportunity to isolate a person in a room or whatever. So that's we do the best that we can in that, still stay home out of the regular public and isolate at home and use, and we work from that standpoint. But so that is the point, is to stay home, isolate at home, and do what we asked you to do. So because we can't pull them out and send them somewhere else, they've got to isolate at home.
We danced around this quite a bit, and I want to try to hit this before we have to go off air, but we alluded to the need for help. How tough is it for you guys to do what you do with the current resources you have? And I realize, Wanda, that's kind of a loaded question. I don't want to get nobody in trouble, but the reality is I think it's something that needs to be discussed, because, you know, the folks need to know. You know, if the wagon can't be pulled, we need to decide what we're going to do here, you know?
Well, and I think that the frustrating piece from the nursing director's point of view, it's very frustrating to see comments, and, you know, you hear the general population talking about, oh, it's not even real. This is not even real. It's not even a real problem. It's a conspiracy. Yep. It's this, it's that. It's like somebody punching you in the chest when you go to work every day, and you are working so hard every day, and these cases are coming in, and you're dedicating your whole work day, and even we're staying over. We have that 24-hour call line, and it's so disheartening to hear that people don't even think this is real, and yet you're, you know, working so hard trying to help your county.
But that exists. You need. I think folks need to recognize that exists.
And we were at one time getting 30, 40, 50 cases a day. So we've had to prioritize in-house, and we've had to look at what services can we provide alongside. We know we've got to do the COVID. We've got to do COVID piece. We've got to do those contacts. So we've got half staff that may be working with that particular piece, and the other half that's having to do some clinical duties.
But the other stuff didn't go away.
It did not go away. That's why we've had to really look and limit what we do in-house, because we've got the issue of trying to do COVID plus. And, you know, the state is offering us the assistance with contact tracers now and investigators, which is going to help once it's fully implemented. But we, as in our health department, has taken the brunt to do what we need to do in order to make sure that we are making those contacts, isolating, trying to provide this service for the residents of Sampson County. That is our ultimate goal. But we must stress, and I don't think you all have heard us, wear your mask, covering, maintain 6 feet apart. Don't think we can stress that enough.
And the indoor meetings, 10 or less.
Right. And social distancing, not just 10 and less. Making sure you're still 6 feet apart. Making sure you've got your sanitizing supplies. Those are our main. Those are the three W's. I don't think everybody should know what the 3 W's are now. I mean, you know.
And Kelly, I heard what you were saying is basically you want folks to know this is the real deal. This is something that you personally, as director of nursing, have dedicated your personal space to. You're fighting it hard as you can, but you need folks to help you. So I want to thank both of you guys for being with us today. There was a lot of things we didn't cover. I'd like to have gotten into. We didn't even touch on the fact of another burden that's fixing to hit you, and that school's opening back up. So as we talk about that could be a whole another show, but the dynamic of this is not going away. Again, thank you for being with us. Ladies and gentlemen, I want to thank you for being with us today. We Should Know will be coming to you each and every week. We look forward to seeing you again next week. And we also, every day, all the time, say safe, say well, and may God bless.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question, comment, or suggestion regarding this or any episode, please send your emails to weshouldknowedu@gmail.com. And remember to tune in every Tuesday at 2:30 for another informative episode of We Should Know.